This podcast is not meant to be professional advice of any kind. It is meant to be informative and entertaining. If you make any changes to your life, see the appropriate professional before you do so. Welcome to Super Age. My name's David Stewart. I am the founder of Ageist and your host on the Super Age Show. We talk about how to live healthier, how to live longer, and how to be happier. And who doesn't want that? Today's show is brought to you by Inside Tracker, the dashboard to your inner health. Go to insidetracker.com/ageist. Save 20% on all their products. The show is also brought to you by Element, LMNT. My favorite electrolyte mix. It's what I put in my water in the morning, and it's what I put in my water at the gym. Go to drinkelement.com/ageist and receive a free 8-serving sample pack with any purchase. Today's show is also brought to you by SRW. Aging is inevitable, but how we age is chiefly a matter of our choices. If you go to srw.co, you can save 20% on all their products by using the code AGEIST20 at checkout. Welcome to episode 129 of the Super Age Podcast. This will be dropping on April the 12th, 2023. This week on the podcast, we've got Kevin Snodgrass and Joe Nocera. And we're going to have a conversation about the intersection of physical exercise and cognitive exercise, which I think is super interesting. And they actually take me through a couple of these exercises where I fail miserably. It's a lot harder than it looks. So they've created the platform Vivo, and we're going to get with them in just a moment. So the news here in less snowy Park City, it seems as though it's springtime. We've exited the ice age. And so now we're in the land of water. There is like water everywhere. And, in some of these counties, there's 800 inches of snow. Snow's going to be there through next year. It's just amazing. It's going to be great for the Salt Lake. Really happy about that. And I have started doing Invisalign. So Invisalign, for those who don't know, is a way of straightening one's teeth by using a series of clear plastic trays. And I started this about 3 weeks ago. And, I'm not affiliated with Invisalign or any of this, but it's kind of magical watching your teeth shift. And so why am I doing this? So at the age of 64, I've decided I'm just tired of looking at my crooked teeth. And I'm figuring about, being around for a few more decades, and I don't want to look at my crooked teeth anymore. And, when I was about 12, I was told we had to, my family was suggested that I get braces, but it was just sort of not within our financial means at the time. So I never did. And, so I've had these crooked teeth for a long time now. But they're slowly moving, and it's amazing technology. I don't know how they do this. Allegedly, I'm going to have them for 14 weeks, 14 trays. And I was really concerned about, drooling or lisping, but there's none of that. It's really easy. So I think this is just sort of part of what we're going to be seeing in a bigger way. People our age who are living longer and perhaps unwilling to put up with minor irritations for what could be many decades ahead. So I think this is we talked to Professor Andrew Scott about this a few weeks ago, the professor from Oxford and London School of Business. We had a lot of very interesting things to say about this. But I'm, sort of seeing this, whereas, maybe the thing, whatever it is, maybe your kitchen bugs you and you want a new kitchen, or you want to fix your teeth or whatever. And it's not all about material possessions, right? It's also about looking forward. If we're going to be around for a while, how are we going to use that time? How can we be useful, and how can we contribute to others? And how can we keep nurturing our knowledge and also our network, our friends around us? So I think this is all related in a way. Today's show is brought to you by SRW Laboratories. Out of New Zealand, their vision is to extend human health span. SRW Labs curates the very latest in science and research to formulate premium nutraceuticals that support your cellular health. especially as you age. Working with their scientific advisory board, they seek to understand and address the causes of aging at a cellular level, providing support across 12 bodily systems with an approach that is unique to SRW. They know that doing one thing well, such as eating healthily, won't have the desired effect on your health. This is why SRW seeks to educate people on the factors that influence aging and, more importantly, biological age. Use the code AGEIST20 at checkout and save 20% off any order. Go to srw.co, not .com. Use the code AGEIST20 at checkout, save 20% on all their products. The second sponsor of today's show is Element, spelled LMNT. Element is an electrolyte drink that contains the exact ratios of the electrolytes sodium, magnesium, and potassium to optimize our cellular functioning for mental and physical performance. Most of us understand that, we need to stay hydrated. But what a lot of people don't realize is just pounding water isn't going to cut it. In order for our cells to function properly, they need sodium, potassium, and magnesium in the right doses. Element has perfected the balance. Now, of course, people with prehypertension or hypertension need to be careful about their sodium intake. But for most of us who are mindful about eating clean, unprocessed food most of the time, we may not be getting enough sodium, potassium, or magnesium. That's why I drink a packet of Element each day. If you'd like to try Element, go to drinkelement.com/ageist, that's drinklmnt.com/ageist, and receive a free 8-serving sample pack with any purchase. Let me know what your favorite flavor is. I'm into citrus salt. What's yours? We're going to get with our conversation with Kevin Snodgrass and Joe Nocera in just a second. I want to remind everyone that after that conversation, we have that bit in the show that we do every week called Just Try This. A little fortune cookie, helpful hint to help you live longer, healthier, and happier. Hey guys, it is great to have you on. I'm really excited to understand more about this, what I find to be incredibly unique program you put together, Vivo. So before we get started, Kevin and Joe, I want to just tell people a little bit about yourselves. Joe, you seem to be the expert on the science here. Tell us a little bit about your background.
Yeah, so I'm an associate professor at the Emory University in the Department of Neurology and Rehabilitation Medicine. I'm also the interim executive director of the Center for Visual and Neurocognitive Rehabilitation at the Atlanta VA. Quite a mouthful. My background is exercise science. Been interested in athletic training, exercise science, sports medicine, strength conditioning most of my life. Had the opportunity a while back to work as an athletic trainer in the NFL, a little bit in NHL, and really enjoyed that. Loved every bit about it, but I knew that I wanted to kind of go down a path where I'd start working with populations that could maybe benefit a little bit more rather than, the athletic population, making them run faster, jump higher. So I got involved with exercise for Parkinson's disease, exercise for patients with mild cognitive impairment. And so for about the last 15 years, that's where my research has been, studying brain health in aging populations with neurologic disease.
Before we get to Kevin, Joe, I want to ask you, it seems like you've got two things going on here. There's the mental cognitive part and the physical part. How do those things intersect?
Constantly. So, we're never just walking through our environment, or we're, rarely just doing a cognitive task on its own. So we're always moving through our environment and thinking about things or having a conversation with somebody. So, the example I always give is you're walking into the grocery store through a parking lot. You're taking in a lot of information while you're walking. Walking is almost automatic until we start to age, and it becomes a little more of a challenge and a little more variable. And when it's more variable, it introduces fall risk. And so now you're introducing these cognitive tasks where you're maybe inhibiting, surrounding noise around you, but you're watching the cars and you're kind of slowing up to make sure the car passes. And then you walk in there, maybe there's a curb that you need to step up and over. All these things greatly impact how fluid our walking is. And anytime we change that fluidity, we introduce the risk of a fall. So what's really interesting from a science perspective is that we can kind of attack both of these with exercise. We know that we can improve the physical functioning profile of pretty much anybody, whether they're in a disease state or whether, they're aging healthy. but we can also really impact brain health with exercise. And that's really what my research is geared at.
Amazing. I'm a sort of a late stage ski racer. And so there's like a lot of processing that has to happen with consequences. And I can tell you that if I'm thinking about something, first of all, I can't think about anything if I want to stay alive. But if I am thinking about something else, I'm toast. I just can't. I can't. Right. So.
Yeah, absolutely. And that even goes down to more simple tasks as we age, as we have problems with aging, like I mentioned, Parkinson's disease or cognitive issues. These dramatically impact how we move through our environment.
Yeah, absolutely. Kevin, I want to get with you. What's your background?
My background is in corrective exercise and rehab, but I love this example of the ski racing and not being able to think about anything else while you're doing it. When you mentioned on another podcast that you were a ski racer, I had to pause it because I was like, I don't even know what this is, and I feel like it would just explode into a million pieces if I tried that, like just shatter. But thinking about like ski racing and then trying to, like, I don't know, think about your laundry or something else, or you couldn't do it, but also proprioceptive changes that occur naturally as we age, right, from postural imbalances are going to cause your brain to behave differently, right? You send different neural pathways to the muscles. So it's not just about, being in tune with your body when you're going. It's also being in tune with these changes that are happening to your body as you age, right? And so having to react to that. And so that's an additional step our brain has to take to, in ski racing as an example, or dodging a car in a shopping center parking lot, right? Your brain's taking extra steps to then react to this stimuli. So when I heard you were a ski racer, I was deeply impressed. I was like, this guy's got an awesome background, and I want to hear more about that. My background is in corrective exercise and specifically rehabilitation. I work a lot with physical therapists, and I take patients post-acute rehab and do postural rehabilitation or movement pattern rehabilitation, whatever caused the injury in the first place, either chronic overuse or some acute injury. Like, how can we work to prevent that from happening again? I've been doing that for 12 years or so. I also I have worked for the last 7 years in mental health. A big part of why I got drawn to this field was loss. I was active, experienced some significant injuries, lost a lot of function, had to regain function, had to retrain my body on how to move. And I deeply wanted to give that back to people. And I do that physically with the corrective exercise, but then working in an inpatient facility for mental health, I'm giving back, maybe sometimes emotionally or mentally, things that have been taken away, right, through mental illness, through acute mental illness, chronic mental illness. And a big part of what I have done over the last more than a decade is, again, giving people back something that they've lost. And so when the opportunity came up to work with Eric and Joe and the team at Vivo, I realized very quickly that older adults sort of think of loss of function as a normal part of this process, and it isn't. It shouldn't be. You're a dang ski racer, right? You can't have loss of function and do that. If we think about just loss of function as sort of a normal part of the process, we're kind of giving up. And what I want to do is show people that we can get back a lot of what we lost. If it's just as simple as getting to the floor comfortably, we can give that back to people. And so this experience I've got in corrective exercise, rehab, and mental health, and just, again, taking loss and overcoming it, we've been able to apply with our program at Vivo and give people back function, independence, and quality of life. And it's been really cool.
I want to sort of go down the age column a little bit here. And, you mentioned that with age, our proprioception changes, and a lot of our sensory input changes, and how our brain processes that changes. Yep. Help me up and down on the ladder. So say I'm 20, I'm superhuman. I'm 100, I'm less than superhuman. What are some of the things that happen, like by say 40?
Well, I think using that example of a 20-year-old and a 100-year-old, we're going to be facing sort of different sort of proprioceptive variables, right? Looking at a 20-year-old, it's likely going to be an acute injury versus some like chronic postural imbalance. With an acute injury, a lot of times your brain is going to redirect neural pathways to avoid pain, to avoid re-injury, to avoid aggravation, right? And so In my specific example, I fractured my hip 8 years ago or so, and my brain shut off function to the hip external rotators because it produced so much pain. And so I had to go through 8 months of rehab to get my glutes to work again. This posterior core stabilizer and hip external rotator just didn't fire. So gait was off. I couldn't lift weights. I couldn't do squats. I couldn't get up and out of chairs comfortably. And it was mostly because my brain didn't want to use those muscles. I had to then retrain my body on how to use that. Now, that can happen with a 100-year-old who has a fall and a break, but a lot of times it's going to come from impeded nerve flow through postural imbalances, right? Think about, thoracic kyphosis, the big arching, the big rounding of the upper back, and then cervical extension, right? Extreme sort of forward head position for a lot of older adults. But we're changing now length tension of our muscles. We're changing nerve flow through the spine to our extremities, and we're changing sort of where our brain thinks our body is in space. And so when we go to like walk, that's going to challenge our gait. And if we trip or we come across an uneven surface and we're having to adjust our gait to that uneven surface, our brain is not able to then very quickly in real time adapt to this texture change of the surface. And that's going to be from that loss of the change in your body's ability to recognize where your extremities are in space.
So when you injured yourself, I'm curious. You had a physiological injury, was and your brain was telling your external hip rotator you couldn't do this thing. Were there other cognitive effects from that? I'm just curious.
Oh, that's a great question. Joe, have you ever used the red cord therapy where you sort of isolate? It's really hard to isolate a muscle, right? But you can pretty effectively get one muscle to fire at a time. Have you used that? Joe is nodding his head for the listeners. Yes. All right. So I was suspended in this sort of this therapy device. It supports your body and allows you to turn on one muscle at a time, and everything else is supported. When we walk, you can't isolate one muscle. Some things are working in a like synergistic system. But I was not able to move my hip. I was not able to externally rotate my hip. But what was happening is the other side was working. And when the PT said, okay, move your right knee, just turn it out to the side, I was turning my left knee out to the side. I couldn't get this neural pathway to actually get to the spot I needed. And so my brain was like, do something, fire, neurons everywhere, just fire, like curl your right toes, and my left hand would work, right? My brain was just like sending signals out everywhere. I just could not figure out how to get the neurons from my brain down to the muscle that I needed to fire. Now, in terms of the sort of the science behind that cognitive impairment, I'm going to lean on Joe a little bit for that. But for me, what I saw and experienced as the patient in this example was my brain said, do a task, and my body did a different task. And we see that a lot with chronic postural imbalances, right? When we have these adjustments in our spine, right, from age, the thoracic kyphosis and extension of the cervical spine, we see changes in our gait that are overcoming not just the center of gravity changes, but then also the brain telling your body to do something and it doing something different.
Yeah, so it's really interesting how you highlight those direct, the brain communication to the muscle. And I'll go the direction of kind of these indirect things that you don't, not everybody always thinks about, but when you're dealing with significant pain or injury, what comes with that? And it's usually inactivity. So these things greatly impact our mental state, right? If we're traditionally active, have hobbies that we greatly enjoy, being out and moving around, and this is impacted because of pain or injury, you just don't do those things. And that has a huge impact negatively on your kind of mental well-being. Sleep is so critical. One of the questions I always get when I present my research that shows that we improve cognition with exercise, people say, well, how do you know they're just not sleeping better? They might be, but if you start impacting sleep negatively, it's going to impact cognition. So it's really multifaceted when you're talking about injury or, age-related changes in mobility that lead to more of a sedentary lifestyle. You just get this multifaceted negative impacts on mental well-being, physical health, kind of that, spiral effect that just, definitely directly impacts cognition.
And as we're talking about the brain, guys, we're talking about not so much the cerebrum, right? This is at the cerebellum level of the brain dysfunction, right?
So it really depends on what we're specifically talking about. So some of the cognitive work that I do is specifically higher cortical function. So
right.
frontal lobes, for example, when I talked about, moving through your environment, there's a lot of executive function, taking in information, updating that information, utilizing that information. That's all, kind of frontally mediated executive function. But certainly, gait, when we talk about gait, then you get into, balance, coordination, cerebellum, brainstem.
Yeah, I was thinking about what Kevin was describing with his. I want to move my right knee and my left knee moves. That's a cerebellum issue, right? Which is sort of way back here, the primitive part of the brain.
Right.
Yeah, fascinating. Okay, so you guys, you've got this amazing program where you unify these two things, and Ashley, who's on our team, does Vivo like 3 times a week. And I spoke to her this morning and she was like, oh my gosh, they made me do this chain of words. So before we get to that, I want to explain this sort of intersection of the, brain function, memory, and cognition with the body function, with the somatic. Explain the program. What are you doing?
Joe, you want me to field this one, or I'll take the ball and then I'll hand it off? All right. So effectively, what we were trying to do is treat the brain as we would any other muscle in the body. The last 20-ish years of neuroscience has shown us that by engaging the brain while we are moving at moderate to intense levels of activity, right, we can stimulate neurogenesis and neuroplasticity, basically regrowth of brain matter and then reconnection of existing brain tissue. And so to do that, right, we want to stimulate the brain. We want to treat the brain like we would, biceps on a bicep curl. And we do that by engaging in sort of fun dual tasking activities. What we were trying to do is affect lots of different areas of the brain to create lots of different neural pathways as well. And so the one that Ashley was involved in this week, today, was a memory sequence dual task where you're trying to remember the sequence of random words. We've got 10 words in a sequence. It's very easy for us to remember the first and the last word of the sequence. What we're trying to do is remember them in the correct order. Doing that by itself, just sitting down and looking at a piece of paper, right, is not going to stimulate that neurogenesis and neuroplasticity. And very likely you're going to find that you fail at that task. When we move, when we're doing, marching in place or doing squats or doing some other automatic activity, right, where we're getting our heart rate up, we're moving our body, and then we are engaging our brain this way. What we're doing is then stimulating that neurogenesis and neuroplasticity, which then creates the growth and the reconnection of the brain cells. And we're doing it by asking Ashley to remember a bunch of words in sequence. And these also have lots of really functional and practical applications. Some of them are occipital dual tasks, where we're asking them to recognize like colors or images and react to that stimuli. Some of them are auditory, like listening for cues from the trainer. Some of them are, some of my favorites are specific memory recall, like unique memories that are yours. And we find that as we do this process, as we go through this like move and recall memories, people are able to recall them faster, with more clarity, with more detail, right? And this is real stuff. These are your memories. These are your unique experiences, and like losing that, right? Losing the access to that of your brain, it has a significant mental impact, right, on your happiness, your joy, your mental health. And so, doing these specific memory recalls and grouping new neural pathways in your brain to access this information that is yours, that is your life. Right, we see so much joy, we see so much happiness, we see so much like sort of fulfillment in this dual tasking. So Joe can talk to you about how it works. I'll talk to you about how we do it.
I'm going to ask Joe that question in just a second, but what I'm curious is, so there's a specific movement pattern, right? So whatever it is, squats or whatever, and so now the say the chain of words or whatever the mental task is. Now, the next time I perform that movement pattern out on my own, I go to like do a couple of squats on my own.
Sure.
Does the chain of words come back to me?
Oh, it's going to come back to you at like 3 a.m. when you wake up in a terror and you're, oh, car, apple, banana. Oh no. What I think you're going to find is maybe not the sequence of words coming crashing back, but you're going to find that the automatic process, the automatic like walking is easier, right? So
Yeah.
let's use this example. This is one that comes up. My mom has done Vivo for 3 years, and she is sort of my very small sample size that I use all the time because I get so much experience with her. But walking and remembering details of somebody else's story, right? So if you are walking and you're listening, you're engaging in conversation. If there's other stimuli, there's cars, there's dogs barking, the change in the floor texture, right? Whatever, your brain is having to then react to that. You are losing details of this story and engaging in the story that someone is telling you. What I have found is that you're able to better remember this information, right? You're better able to respond to this because the automatic process is then easier. Your brain is reacting to the walking and the external stimuli and not having to divert so many resources that pay attention to that. And so you just find that, wow, I'm not at a fall risk. I don't feel like I'm at risk of tripping, walking on an uneven surface and talking to my friend and remembering the details of this story. So maybe you won't remember the 10 words in sequence, but who cares about that? Because you will remember better what's happening in real time, in these stories that you're engaging with your friends, right? And then again, in this example, walking on an uneven surface with less risk of falling.
So I want to ask Joe. So what we're talking about here is simultaneous multiprocessing, and increasing the processing speed, the ability for the brain to handle this. Why does it? I don't get it. How does this work?
So, yeah, complex, right? Very complex, and we certainly don't have all the answers yet, which is what I'm trying to do with my research. But one thing that's really important to highlight that we do know is that just exercise by itself. So you're just exercising, your heart rate's up. This by itself is going to sort of prime the brain, neurogenesis, neurosynaptic connections. We increase what's called brain-derived neurotrophic factor with exercise, so that makes for a healthier, more efficient brain. There's some neurotransmitters that are enhanced with exercise, GABA being one of them, which we study. That's an inhibitory neurotransmitter. So just exercise alone has been shown to facilitate a healthier and more efficient brain. That's by itself. What we're doing when we're combining exercise and sort of a mental challenge is, kind of as we talked about, think about prioritization, right? You're finding that as you're aging or having difficulties with multitasking, that you're going to prioritize, if subconsciously or not, what safety, right? So you may, if it's a situation, going through a grocery store parking lot, you're going to prioritize safety. And so that cognitive aspects that you were, once focused on, now you're kind of focused on walking, moving through the environment. So maybe you discontinue that conversation you were having, or you're just not prioritized. You're not hearing that stimulus around you. What we're doing is practicing that. We're engaging that system, that prioritization system, so that when you are actually exercising, increasing your heart rate, priming it through beating up through these neurotropic factors. Now we're introducing the secondary task, so your brain can now more efficiently prioritize and work simultaneously, rather than saying, "Hey, I got to prioritize this," and we're just going to forget about the cognitive side of the equation. In a laboratory setting, when we have people engage in a secondary task, you can see because it's a gait laboratory or a walking laboratory, they know what we're measuring. And you can see that they are clearly prioritizing walking, and so much so that if the task that we're measuring them on, the cognitive task, is essentially a yes, no, true, false, they're performing at 50%, which means they're guessing. They're completely prioritizing walking. And so the idea is that you can train the system just like you can your biceps, your quads, and you're going to introduce these secondary tasks while they're exercising and really prime the cortex, prime the system so that it becomes more efficient.
So, as you guys know, one of the sort of foundational laws of any kind of conditional training is progressive overload. So that's, causing a hormetic adaptation. Okay, so let's take that to the brain. Is it the same thing? Like, does that chain of words go from 10 to 20? Is there progressive overload that would happen here? I don't know.
Joe, field this one.
So in terms of how we progress the program, it's always progressive. It has to be. And the nice thing about the dual task is you have two different inputs that you can challenge the system to. So if they're doing Squats, for example, you can increase the volume, you can increase weight even. So you can hit it from that side, but you can also increase the challenge of the cognitive task itself while they're doing the secondary task. So it has to be progressive. Yes.
So what we're seeing in real time with our members is improvements in efficiency and efficacy of their patterns, right? So they're, for example, if we're doing a contralateral march where we're walking in place, but we're reaching and touching the opposite knee, we're engaging both sides of the brain, and we're doing a really specific movement pattern. A lot of times when we then engage in the dual task, which is the cognitive, like answering a question, we see the movement pattern then sacrifice, right? We see them not be able to move contralaterally, or they stop moving altogether. What we want to see is then improvements in the quality of that motor skill, right? With improvements in maybe the ability to answer questions or to respond quickly to questions or to react to stimuli. Will you be able to remember 20 words in a sequence? That is not a question I've received. Well, hey, let's try it out. Let's
progressive overload.
Progressive overload. But what we do see, and what we stress is that early on, it's not about doing it exactly right. I want to go ahead and address maybe one of the objections we have to dual tasking is that people are afraid that they're not going to be able to do it well. And it doesn't matter. When you're starting this, doing it at all is just as effective as doing it well. Even maybe doing it and failing is more so effective than doing it well. Because if you're not sort of getting to that point of challenge, we're not doing anything with your brain, right? If I asked you to march and answer one question, it's not going to be as effective as if we did it for 30 seconds or a minute or 2 minutes, right? And so when we're doing this, we want to see improvements in their the quality and efficiency of both the motor skill and the cognitive function. But then we also want to then increase the challenge. And as they get better at those, we'll increase the challenge more. One example is a number, like similar to the word sequence, the memory sequence. We do a color number recall. We assign a unique set of colors and numbers to each person. So David, maybe you are red and number 1, and Joe, you are blue and number 2, right? And as we go through this workout, I'll call out David, red, and you will say your corresponding number, which is
1.
1, exactly. With some of our more advanced groups, you'll have a 3 or 4 digit combination, and you'll have multiple of those. So maybe you have red and green and the numbers associated with it. So yes, there is that increase in the challenge as you show better effectiveness in the dual tasking.
This is super interesting. And I'm going to ask you guys a question that you may not have the answer to, but it's just occurring to me that, if we go back to your injury, Kevin, about how, you told your left knee to do something and your right knee did it. So there's sort of a miswiring somewhere in the cerebellum. Oftentimes as people age, and I'm not talking about like Parkinson's, but people tend to have a little bit of a shake or a tremor, which I believe is a similar sort of cerebellum-based miswiring. I'm not going to say dysfunction, miswiring. Is Vivo training, would that help address this sort of thing? I have no idea.
It could. There are so many reasons that you could experience that shake that it could, and it also won't. Right? It sort of depends on the diagnosis.
Yep.
Joe?
Yeah, like you said, there's just so many different reasons for the essential tremor of Parkinson's. The good news is that exercise is really good for Parkinson's, so you could have some benefit there, but it would really depend on the nature of the pathology causing the tremor. And you'd also see where you introduce these kind of high stress situations where it would increase, the actual tremor would increase.
Maybe so. One maybe similar example, I guess, is the ability to stand on one foot unsupported, right? That is something that everybody has experienced at some point or will experience at some point, right? Standing on one foot is a basic human function. And we do see improvements in that by doing the dual tasking. When we do a lot of single leg balance work appears in every single one of our sessions in some form. And a lot of times we'll do single leg balance and incorporate that into a dual task with answering questions or doing 2 motor skills, right? Following a complex movement pattern with your arms while you're standing on one foot. And that we are seeing significant increases in our members' ability to stand unsupported for longer durations of time.
Joe, tell me about the science on that. Why is that?
So you're just, again, you're challenging your balance system. So you have visual inputs, you got proprioceptive inputs, and just like the muscle, just like our brain, when we stress these things, they improve. The nice thing about improving balance is that every single person in vivo, once you get to a certain age, your chance of falls increases greatly. The terrible thing about that statement is that we have no way to predict who's going to fall. Our number one predictor of falls is a previous fall, and that doesn't do anybody any good. So that's always one critical component of any time anybody asks, oh, I have, I'm this age and I feel like I need to start an exercise program. What do I need to do? Balance is always on the list because of that increased fall risk.
I tend to do, when possible, I'm standing on one leg right now. I do all my podcasts on one leg. I don't do 20 minutes each leg. I do 1 minute. I alternate. But when you guys do when you're doing your exercise program, do you recommend people to be barefoot or in shoes? I do everything I can. I try and do barefoot.
That's a great question. I'm gonna raise my hand. That's a great question. Yeah. Yes, as long as they can do it safely in their environment. Yeah. So this Vivo is a fully remote program, right? Mm-hmm. So it's all done virtually over Zoom. I can't be there in the same space as the member, so I'm guiding them through it. So as long as their space is safe, clear of obstacles, and they can stand barefoot, right, comfortably and safely, then yes, we're going to recommend it all the time. Now we do that mostly in our mobility and our single leg balance components. One thing we do in our mobility components will be occasionally using massage tools like a lacrosse ball or a tennis ball to work the soft tissue at the bottom of the foot. And there, obviously, we want them to be barefoot. And then we want to use that increased mobility to have them stand on one foot with better articulation of their foot. When they are doing exercises, sometimes it can be more comfortable for them to be in shoes. So a lot of times we'll have them then put their shoes back on. But when we were doing a balance component or mobility work for the foot and ankle complex, yeah, as much as possible. Yeah. And sort of like going back to your progressive overload, if you try to do a workout barefoot, right, out the gate, having been in shoes for 40 years, it's going to be uncomfortable. You're going to find that maybe your calf is sore, your Achilles is sore, right? Even up into the hip and lower back. And so, right, doing that for a little bit for mobility work and for single leg balance is totally fine. And we see improvements in articulation of their foot and their toes. Yeah,
it's one of my pet bugbears are as people get older, they feel the need to wear these really heavily cushioned shoes.
Yeah,
which is just it's horrible. It puts all the nerves in the bottom of your foot to sleep, and then that's like a big part of your brain, right? Yeah. So that's why I try to do everything I can barefoot. Yeah.
Yeah. I mean, right. Think about that proprioceptive change there. Proprioception, again, is your brain's ability to your body is in space. If you're wearing these super cushioned shoes and you lose that sensation at the bottom of your foot, you don't know where you're right. This is your connection with the ground. This is one of a few reasons that older adults tend to shuffle their feet, is because they know where the ground is, right? But that increases your fall risk significantly because your trip hazards then go up, right? Anything can be a trip hazard. And so training people to lift their feet when they walk is what we should do, but we can't do that if we have lost the sensation in our feet, right? And yeah.
If you've ever been to cultures where they don't wear cushy shoes or any shoes at all, it's a very different gait. Even people at advanced age, it's just a whole different thing. They have a much better relationship, the body to the foot to the ground, like they know where they are all the time. Yeah. That's my bugbear of the day.
We support it.
So tell me, I know you guys have been doing this program for a while. Tell me some success stories. What have you been seeing?
So sorry, Joe, I'm gonna jump in on this one. One of the things that sort of brings me a lot of joy is I struggle with remembering people's names when I first meet them.
Oh, wait. So you, Kevin, the trainer, have a cognitive issue. You cannot remember people's names. Even, I'm curious about this, even though you're on Zoom and their name shows up.
No, I can remember it if I can read it, David. I can read with my eyeball.
Okay, you can read, but you can't remember. seeing the
all right,
face.
so
This is an issue. We have a program for you.
Go if you get right a social engagement. This is one where it really stands out, right? You go to an event and you have to meet a bunch of people, and you're like, this somebody's like, hi, my name is Stan. I'm like, cool. I couldn't, with a million guesses, tell you your name, and you just said it to me. And the reason I bring this up is because I had a member tell me this. They were resistant to doing the dual task. They didn't enjoy the dual task, and they said, "Dang it, I can remember people's names now." And I was like, "Oh well, okay, yeah, you're welcome." I guess moral of the story is I need to do my own dual tasking. Fine, I get it, David. Stop looking at me like that. Yes, I understand. But no, this is one of those like sort of acute, really personal wins that we had with somebody saying, "Hey, this I can do now," and it hit home for me because it is one of my like known struggles. So I guess go ahead and push your podcast on. Tell us which episode we should listen to for remembering people's names. Just kidding.
Yeah.
Joe, what? Tell me about your stories.
I think the way people engage, that's one of the hardest things that we're just not able to study that as well as we need to. So in our research programs, we show benefits, whether it's physical, whether it's cognitive, but there's something about the piece of people working in groups together, virtually or in person, where they become sort of part of a team and sharing their stories and sharing their struggles. And there is something to that. A lot of people are really embarrassed and have a fear of doing the dual task because they know they're not going to do it well. And so, them kind of going through that struggle together really brings out, progress, right? They're just more willing to open up to one another again, share their stories and work together. And I think that is a piece that we don't study very well, but that togetherness, that teamwork is really special. And I think, Vivo and just group exercise in general, it's more than just increasing that heart rate, and improving their cardiovascular profile, improving their brain health. It's also their mental outlook and the way that camaraderie. I love seeing it every time.
So it can be easy to talk about this, right? And the listeners can hear this, but I don't know if they can conceptualize it. I don't know if they can experience it without actually experiencing it. If you guys are up for it, what I'd love to do is run you through a really simple dual task so that the people listening to this podcast can understand, oh, okay, this is what they're talking about. When I'm talking about like a color number or some memory sequence dual task, it's all theoretical. Why don't we actually do one real quick?
Okay.
It'll be fun. It'll be engaging. It'll be embarrassing. It'll be great. And like Joe said, it's going to bring our little community together. We're going to feel more connected after having gone through this experience together.
This is a first. Okay.
All right.
Let's do it.
So I'm gonna have you guys do a really sort of familiar but complex movement pattern. We are going to do a march in place with a contralateral touch. It's really simple. We're just going to reach across and touch the opposite knee while we're marching. So you can do this standing or seated. But the movement pattern is specific. You're going to bring a knee up. You're going to touch the opposite knee with your hand. All right. So as we do this, we're engaging both sides of the brain. Right. So it's a complex movement pattern, but it follows our normal gait. When you walk, it's contralateral. One knee up, opposite hand out in front. Okay. I'm going to have you keep this movement pattern going, and then I'm going to ask you to go back and forth and answer one of my prompts. I'm going to give you a prompt, and you'll have to give me an answer to the prompt. Let's do this. Let's actually do this as a team. We're gonna keep. I see you. You got to keep marching. You can't. Part of the dual task is listening to instructions and doing
all
that.
Uh,
right.
Okay. All right. Bring it back in. All right. We're going to go up in alphabetical order. Let's do this. We're going to do a sequence of words in alphabetical order. All right. I'm going to call on you one at a time, and you got to say the next. The answer has to follow the next letter of the alphabet. All right. We're going to name fruits and vegetables. Really simple. Okay. Fruits and vegetables. We'll start with A. All right, Joe. I see Joe's face. I wish you guys could see this. I see Joe's face. Man, the furrowed brow, the head down, concentrating hard on what an A fruit or vegetable is. All right, Joe, go first. Keep the contralateral march and give us an A fruit or vegetable.
Asparagus, of course.
David.
And it has to follow. Do I do a B or an A?
You do a B.
Blackberry.
All right, Joe.
Cantaloupe.
David.
Dates.
David, you're looking around the room. Are there dates in are there fruits and vegetables?
Come on, dude. This is my first time.
All right, Joe.
Nobody does this to me on this show.
Eggplant.
Eggplant. Love it. All right, David.
Figs.
Figs. Joe.
What do we have? Oh boy.
David, are you watching his movement pattern while he's doing
Yeah,
it?
it's totally falling apart.
Just
Here's
falling
the
apart.
exercise guy. He's lost his whole movement
This
pattern.
is great.
Everything's failing right now.
We're gonna say grapes. All right, David.
So we're EFGH, hemp.
Okay, let's pause there. Because you relax, shake your arms out if you need, relax your legs.
You would have seen bullets coming down if I would have had to do an arm.
But David, what you saw in Joe, we saw in you also. Every time you looked, you changed your gait, your rhythm fell off completely, right?
Yeah.
And then you got the word, and then you went right back into it. Okay. And so what we want to see is the next time we do this, I want improved rhythm, I want more consistent rhythm, improved movement pattern, and then I want those answers to come a little bit faster, right? And that's where we're going to see that progressive overload, that change. And also, we got to joke on each other a little. We feel a little bit more connected in this moment. And when we're doing these with, let's say, specific memories, right? If we went back and forth and you gave me a specific memory from your past, right? We get to know actually the people that are in this room on a more personal level, and it brings us together. It's going to do things like build peer accountability. It's going to make the workout experience a little more personal and more fun and more engaging, right? And that's going to drive a lot of the attendance and the consistency that we have seen, which then also results in better outcomes with the dual tasking.
I have to say, it was harder than I thought it would be.
Way harder, right?
Yeah, like I can sort of only do one well.
Yeah.
And that is consistently what we hear from people. It's harder than I think. And again, apply this to real world. Walking through your environment where the stakes are high. Falls are a fall in a parking lot is devastating to somebody that's over a certain age, osteoporosis, and we're marching in place. But we could do the same example where you're walking across the room and you'll see just as significant of a change in your gait pattern doing a very challenging, complex task.
And our goal, David, is exactly that. Our goal is to put you in a situation where you're doing a replicable, real-world, functional activity or task that would be unsafe otherwise, right? And we're going to train your brain, we're going to train your body on how to do this safely, because you are going to do this. A good chance is you can do this every single day of your life, walk and talk. And if we can do it here and improve the efficiency and the safety of you doing this, right? In this controlled space, you're going to be much safer outside of here.
I could, when we got into the later words, I could feel my brain straining, and it was a bit embarrassing. I'm thinking, it's just a word. You're just doing this silly movement pattern. What's the word? But it's like everything's sort of locked up, and I could only do one, either the cognitive or the movement. Well, I couldn't do both.
Well, yeah, and look at me. I couldn't even get that G. I'm just glad this isn't being recorded. I'm glad nobody's ever going to hear about that.
That's the prioritization that Joe mentioned specifically, right? Your brain is prioritizing one of these tasks, and we had just called on Joe for falling off of his movement pattern. So your brain, you're consciously already thinking, well, I've got to keep this movement pattern going, and I've got to remember an H word, right? You're prioritizing the movement pattern and the quality of that movement pattern. So yeah, of course it's going to be harder to remember. And if name an A vegetable right now.
Apple, or that's not asparagus is vegetable.
Whatever.
Avocado.
Yeah, it's right.
Easy.
Like that. Easy.
Right.
Yeah,
right.
No issues. But again, that prioritization, your brain was diverting resources to then do this other function. Now, the more you do this, right, the easier it's going to be to do both of these things: the automatic processing, this task, this motor skill, and then respond to the stimuli that I'm giving you.
So you're building a better brain is what you're doing,
and having fun doing it. I mean, we laughed a lot, and you're.
It's really silly.
What? Right? It was fun. It was fun, and it's really highly functional as well. Yeah.
This is this is fascinating to me. I'm going to go back to my I want to say I'm a ski racer. I didn't say I was a good ski racer. So we just need to be sort of level set here. But whenever they bring in some simple new task, right, mm-hmm. Whatever it is, and it's usually some little minutia, the whole rest of it you just forget, right? Until it gets wired in. And then of course, once they put these red and blue flags in front of you, the whole thing goes out the window and it's just survival. Mm-hmm. But that's sort of what we're talking about here.
exactly what we're talking about, right? I mean, your stakes are high when you're a ski racer. Well, also somebody who is 85 years old and has osteoporosis and is still living independently, living alone, their stakes are high doing
Absolutely.
normal functions, right? Yeah. It's just as dangerous for them to do normal tasks. And so by doing the dual tasking combined with our focus every day on single leg balance and on strength work and improved mobility, right? Independence, quality of life, we're increasing better livelihoods here by doing all of these things, integrating all these things into every one of our sessions.
Amazing. How many people are in each session?
8. So we have 3 different types of classes that we run. We have a foundations class that is it's going to be a little bit slower pace and focus mostly on assisted exercises. We'll cap those classes at 6. We want a lot of touch with the individuals. So it's 1 trainer, it's 6 participants, high touch, right? And these are mostly regressed exercises. These are always going to be assisted movements, less time standing unsupported, more time seated, focusing on strength movements. The Vivo class right in the middle is going to focus mostly on unassisted and weighted exercises, and that's going to be capped at 8 people. And then we have a Vivo Plus class that is going to be for individuals who feel comfortable doing dynamic movements like jumping, hopping, or skipping. They've got to be able to get to the floor comfortably in that class. That we're going to cap at 12 people because most of those participants have some experience with exercise. We're not spending a lot of time, coaching new like fundamental movement patterns. We're basically getting them to increase the challenge of the familiar movement patterns. So those are capped at 12 participants, a little bit higher function, a little bit more volume in those classes. But mostly right in the middle is 8 participants. So the trainer is getting a lot of touch with each person. And so there is a lot of that interaction, that brain engagement. If you're in a class of 50, it's real easy to not do anything, right? It's real easy to sit back, not do these sort of maybe silly or maybe slightly embarrassing or vulnerable things like dual tasking can sometimes be, and then also not get any benefit out of it. These classes there are 8 people, we're engaged. They're also really, really safe experiences. I don't know if you can see behind me, I'm in my living room. This is about as safe and as comfortable a place I can have to work out because I'm doing this at a home field advantage, right? I'm in my living room. So doing these dual tasks here feels a lot more comfortable than it would be like at a gym or in person, right? Where I feel like people are watching me all the time. This is a computer. This is a TV screen. Nobody cares about that, right? I'm safe. It's a controlled environment. I feel more comfortable here, and I'm getting all the benefits of the strength training and the cognitive work that we're doing.
How long is the class?
It's 45 minutes. It starts with a 5 to 10 minute warm up, depending on what we're doing. We'll include some mobility work into that. We've got the single leg balance that we'll sprinkle in there. There's going to be a dual task that will appear in the workout. The bulk of the time, about 25 to maybe 30 minutes, is going to be focused on some strength movements at different intensities, depending on the week and our periodization cycle. And then we finish with a cool down. I mentioned the periodization cycle. All that means is that every week, upon advice of our awesome scientific advisory board, Joe and the other team members, we change the intensity of the workouts each week. So one week will be really heavy weights at a lower overall intensity, and then one week will be higher intensity, lower weight, moving faster, more focus on power production, right? And we'll go through this cycle of low, moderate, high intensity activities. It gives your body a chance to recover from the stress of the previous week, right, and be ready for the stress of the next week. Just we're allowing our cardiovascular system, our central nervous system, a chance to recover, repair, and be ready and prime for the next one.
For me, it would be my brain with this vegetable test. I'm going to need a week to recover from this.
Also that. And we also, right, we're not going to hit that same dual task and the same sort of primary function of the dual task every time. So it wouldn't make sense for us to do vegetables every week. That's not something we would see stagnation really quickly, right? Mm-hmm. So each week we're going to vary the goal of the dual task, like a motor learning dual task, learning a complex sequence of movements, right? Following along with like a unilateral yoga complex where you're having to move one side of your body at a time. Okay, focused on doing that well, and that is a dual task. One week it is going to be listening to auditory cues from your trainer to respond to that, right? So maybe you're marching in place, and every time I say up, you touch the ground, right? Like that's that's a dual task. It's a response dual task. You're responding to stimuli, but you're not having to then say vegetables that go in alphabetical order. So each week, we're going to vary that. Just like we do our intensity periodization cycle, we have a similar thing with our dual task and trying to affect lots of different areas of the brain and functions of the brain.
And if somebody wants to join Vivo, what do they do?
Oh, that's a great question. So 3 times a week, we offer a free trial where they're welcome to come. And they'll actually do this with me. We'll run through a session, just a sort of a demo session. I'll explain all the different components of the Vivo workout. If somebody is like, you know what, I like that Vivo Plus offering, I want to just try out a class. If they reach out to the care team, they're welcome to sit in on a class for free and just check it out. If people are more curious about the foundations of the Vivo class, they'll do a free trial with me on one of those three classes we offer during the week. And it's free. There's no obligation. I want to make sure that this is the right experience for somebody. So I'm going to talk them through all of the parts of the Vivo session and make sure they feel really comfortable with it. A big question we get is what if, well, it's not a question, it's more of a statement. I can't do this. And so, the question is, what can I do instead? We talk through our level progression and regression system that allows us to accommodate and individualize the workout for each person. I know we're here to talk about the dual task, but that's a huge part of this workout experience, is that every exercise, every single movement we have has an assisted version all the way up to a dynamic version. So we do have a progression and regression system that allows us to be infinitely adjustable for each person's need, knowing that those needs are going to change every day. And so they will come do a free trial with me, and we'll just talk through all of this stuff.
This is a bit random, but I remember I had somebody on the show, and we were talking about physiology and mental, emotional linkages. And she said to me, you only have one nervous system. It's the same nervous system for all of this. And if something is not working in one part of it, it's not working in all of it. People, like, we tend to separate this idea of the physiological or the cognitive or the emotional or the immune, any of this. It's the same system, So yeah,
I'm stealing that. I'm going to steal that. I still work in mental health. I do 15 hours a week working at an inpatient facility here in Atlanta. And what I see there is exactly that play out, right? When you are depressed, when you're anxious, when you are, I don't know, like for most of us, it's just generalized stress or anxiety, right? You're not able to function at a high level if you're feeling that way. And yeah, it's because there's one nervous system. And the good news is the exercise dual task, right? That helps with the Joe. Yeah, your hand's up. Joe's going to talk about this too.
It really is an interesting comment, and I may borrow that as well. But yeah, from a science perspective, we always do that. We try to study one aspect and how it impacts one thing, and that's not how our bodies are, and that's not how our environment works. If somebody asked me, my mom's 72, what should she be doing from an exercise standpoint? I would never say just one thing. We gotta attack flexibility, we gotta attack fall risk, we gotta attack sarcopenia, so we gotta work those muscles, we gotta cardiovascular health. But yeah, on the science side, we are always doing that. Just tweak this and measure this.
Yeah, it's like we were mentioning feet. So you would have to probably test. I'm not a scientist. You'd have to probably test this. My guess is, if you improved somebody's ability to use their feet better, they're probably also going to think better. Like the whole, it's all of one, and I think we're in this duality. It's not.
I completely agree with that. Yep.
Yeah. Have you ever had an old computer that was like that was getting bogged down, and you go to like your little Finder thing and you look at the running programs and you realize that there's 100 programs running,
yeah.
And you're like, what? Why can't my web browser download this video? Well, yeah, because you've got all these other functions and tasks running. It's exactly the same thing here. If you make some physiological change to your foot, which means that your body is able to adapt to stimuli from the ground better, right? More efficiently. Your brain is not having to then divert energy and resources to then react to this stimulation. You are going to be able to do cognitive tasks better. Yes, your brain is going to function better. So yeah, if we roll the bottom of your foot, you're going to see improvements in hamstring flexibility. You're going to see reductions in low back pain. Your shoulders aren't going to hurt as much, and your brain is going to work better. All because we just massaged your feet for a second. Yeah,
exactly. Gentlemen, it has been wonderful having you on the show. I think this is just so fascinating that how I think it's us in the West. We've managed to do this sort of like separation of the neck up and the neck down, but it's all the same thing.
Yeah. And we're seeing a revolution in that, right? We're seeing, I mean, in the last 20 years, people are coming to that realization that, whoa, this is all one interconnected network. These are not closed systems, right? That behave independently of each other.
Yeah. Pleasure having you both on. Anybody wants to join, go to Vivo.com. Right?
TeamVivo.com.
Team Vivo, excuse me.
TeamVivo.com.
Oh gosh, I'm so terrible with the readouts.
Oh man, see, this is why we have got to do more of the dual tasking so you can remember we should have done this before.
Just think when I get to the M and the N's and the O's and the P's, I totally lose it. Guys, thanks so much. Enjoy the rest of the day. I really appreciate it.
Thank you.
So that was really fun. And I got to tell you, I wasn't faking it. Like, that was hard. It's really hard to do things and think at the same time. Like, it's not like walking and chewing gum. It's harder, and I can totally see the cognitive benefits of this, and obviously the physical benefits. We're going to get with Just Try This in a quick second after a quick word from our sponsor. Today's show is also brought to you by Inside Tracker. Inside Tracker is the dashboard to your inner health. We talk about this a lot, about metrics, what matters, biomarkers. The thing is, you can't take actions on things that you don't know about. And what you don't know about can hurt you. I use Inside Tracker. I take their ultimate test 4 times a year. I look at their biomarkers. I see what's moving from quarter to quarter so I can see if I've made changes in my program and my diet. Is there something that I need to adjust? And their food first, supplement second recommendations are great. I always share the results with my doctor. And if there's something we need to go over, we do that. Get a dashboard to your inner health. Go to insidetracker.com/ageist. Save 20% on all their products. This week on Just Try This, my suggestion is to inject a moment of slow time into your week with a friend. And what I mean by that is maybe just invite somebody out to, not really do anything, just like maybe have a cup of tea, have a coffee or something, and just hang out and talk and just be slow, not trying to achieve anything, just be present. Ask your friend, how are they? What's going on? Let's just catch up. I'm going to tell you a little bit about what's going on here. I think that very often, especially for us guys, any kind of meeting has to be, around achievement of some kind. Like let's go fill some sandbags or something. But my suggestion is this week, call somebody you haven't spoken to in a while and just say like, hey, let's hang out. Let's grab a cup of tea. Just try this. Thanks everyone for joining us on the show this week. And this is the time where I say you get a chance to give us up to a 5-star review wherever you're listening to this program. And we would so love that. We would also love a comment. But what would really make my day? Share this podcast with somebody you think could use it and ask them to subscribe. We love that. If you want to contact me, David@superage.com. I answer all of my mail promptly and personally. Next week, we got another great one coming up. Hope to see you then. Everyone, have a wonderful week. And hey, it's springtime. The birds are out. Enjoy them. Take care now.